So this is from a 25 years old lady. Is it normal for women to have a higher sex drive than men? Start with you.
Well, is it normal for women to have higher? Did I have sex?
Now he's asking me.
I haven't thought about it. I haven't thought about sexual. What I've thought about is that I know that women are more into sex.
They're more active.
They are more they enjoy the sexual act more, more than men.
But why do guys like saying that particular thing?
Which one?
That women are more, they enjoy the
They
sex
enjoy
more
the
than
sex,
men.
like God has given them the organ.
But they are both enjoying it.
No, they're not. It's at two different levels. Women have like 5 levels.
Okay.
No, yeah.
All right.
Well, okay. I think the other term for sexual drive is libido, and so different individuals, different levels of libido. I do not think it has any association with gender,
Okay.
actually. So, and then what drives a person's libido are the hormones in the person's body. So, actually, I think the major hormone is actually the male hormone. That is why it is actually seen that men are more sexually active. I don't know why he's saying it, but they like putting it on us, but it's fine. So, but actually, there are some women that actually have a lot of, because we both have, as we are all sitting down here now,
Yeah.
we actually have the same hormones playing in us, but we have one more than they do, and they have one more than
Yeah, we
we
do.
do, and that's what gives them the male features, the facial hairs, the masculine features, the deep voices, and not the rest, and the sexual drive too. And then we have ours, which is known as estrogen, and that's what controls every other thing, the period, the ovulation, and all that goes on in our body. So women also have testosterone. They also have estrogen, but very low levels. We also have, but very low levels. But then a woman begins to have a higher sexual drive than a man would if she has high testosterone levels. And there are ways to actually tell. You can find women with they call it male pattern of hair distribution, and there are other things actually. I just point to the fact that this lady has a higher testosterone level than she should have normally. But apart from that, like I said, the libido, the sexual drive, it's not gender based, it's individual based. So depending on the hormonal interplay in a person. So if you have higher testosterone levels, definitely there'll be higher libido, there'll be higher sexual drive.
Okay.
So it's not gender based.
So do you support her?
I think
It's not gender based.
It's not gender based. But
Yes.
it's more of your activity based when you're
Okay.
thinking pattern.
Don't put
based,
it on
yeah.
us again. Thank you. All right. So this is from a 20 years old man. Can lack of sex affect my mental health? This is quite funny.
It can.
How?
I have to support it.
Why are you supporting it? So how can it affect?
Lack of sex can give you depression. It
Mm.
can it can blow your mind, especially if you've been active. If you've been active, and then it's just like you. Especially it depends on how the person likes the activity. Right?
Okay.
If it's an activity, you're one of your leisure activities. And
So
then
what if it's a virgin?
lack of eventually cannot complain of lack of sex. I never tasted it. So,
Okay.
yeah, but I'm trying to remember the words he used there.
Mental health
It can affect your mental health. Yeah, it can make
For
you,
real?
It can make you lose your pride.
Mm.
Yes, you lose your pride. You lose your confidence.
I've never heard of that.
Self-esteem.
I'm about asking if he has any scientific background for what he's saying.
I'm doing this because I'm doing this from
Have you experienced it before?
from-
It seems you've experienced it.
I can relate to him.
Okay.
I'm saying from a more social point of view, right? It affects you because for men, it's more like you test your strength.
Yeah.
You see a lady, you want to woo her and all of that, and then if you're not in the game anymore, it kind of affects you because the other men are in the game, so you feel inferior.
Left out.
You feel inferior, feel left out, and it for your mental health, personally, and no, not personally. For your mental health,
Just say it.
Just see, just we're not judging here. We say we don't judge.
Exactly.
so it reduces your
Okay.
your strength.
All right. How about you?
Okay. And there's an angle that I want to look at it from.
Okay.
So somebody is asking if lack of sex can affect his mental health, it means that this person is already having sex, abi.
Mm.
And then there's now, how will I put it now? There's now a little bit of abstinence. It's no longer like it
Mm.
used to be
Yeah.
before. So actually, we've come to understand that sex actually brings some kind of pleasure. Yeah.
Mm.
So if it's something that somebody is already doing, let's use something else as an analogy. If somebody enjoys a certain meal a whole lot, and then for a long while the person is not getting that meal, of course you begin to crave it now. And if you're
Yes.
not getting, I don't know, like me now, I've been craving these yogurts and I've not had it and I've been very sad.
Yes.
So what that means now is if you cannot get something that brings you pleasure, something you're craving, most definitely you will be sad. But I will not go straight to put it that it will affect your mental health completely. I can only say that it can affect your mood and
Okay.
probably your activity pattern in a way. If your mind is constantly there, if your mind is constantly something that you're craving and you're not getting, it will definitely affect you. That's the way I can think of it. But I cannot say it causes you mental health problems directly.
In the long run, once you're going in that way for
Okay,
like 2
then you
more weeks,
now leave. You know?
All right. This is from a 25 years old guy. Is it normal to have erectile issues as a man?
is it normal
Yes.
to have erectile issue? It's not normal, please.
Okay.
It's not normal, and then that's where the masturbation comes in. Yeah, that's one of the consequences of
Okay.
masturbation, because you will not have erection when it's time to have the erection, because you used
Okay.
up your strength, and that's one of it. And then another thing could be that if you had multiple episodes of infection, multiple over like 5 years, it affects your erectile strength, and
Okay.
especially gonorrhea actually affects you untreated so much. If you delay for treatment, it affects you. So these are like a few things, and then your urges to look at your activities. If you're so much active, like they always talk about the bus driver that always sit down a lot of times.
Yes.
Yeah, your day-to-day activities affect your erection. But it is not normal. A 25-year-old should be active. It is not normal for him. He should
Okay.
seek professional help, and he should find out if he has the urge first of all
Okay.
before he complains of erectile
All right.
dysfunction.
Okay, I don't think I'll be saying anything new to what he has already said. It's not normal, especially with the age. I think if a man in his late 80s is having that complaint, you will not be so bothered. But for a 25-year-old, it's not okay. And there is no sit at home remedy. There's no sit at home remedy for this one. You should go to the hospital the earlier
The
the better.
better. All right. Next is from a 19 years old. I noticed bumps around my private area after shaving. Is it normal or an infection?
Okay, bumps around private area after shaving. Well, bumps around any area after shaving is actually very, very normal.
Okay.
And it comes from the technique of shaving. I'm very sure that she must have seen even guys that after shaving their beards sometimes they find bumps around that area. So, like I said, it comes from the technique. So I will not delve into the technique. Rather, I will talk about things that she can do to actually prevent the bumps
Okay.
from coming out after shaving. So the first thing to consider is the type of blade that is being used to shave. There are a lot of things that while growing up they actually didn't educate us on. But
Yes.
if you actually go online and check, you actually find most of this information. So one thing I learned recently was that the type of blade you use in shaving is actually important. So when you buy a shaving stick, there are some of them you see twin blade on the pack, and then some of them is just single blade. So I learned that the ones with twin blades or the ones with greater number of blades, they are better. Reason being that if the blade is more than one and the person uses it to swipe on an area once, it removes the hair that first time rather than the person
Going
having the
back
action of
again.
going over and over. And that's under issue with shaving with let's say a blade that is blunt. You're using a blade multiple times, that kind of thing. So like I said, it's about the technique, type of blade. That's one thing. Another thing is the technique. It's advisable to shave in a particular direction, and that's the direction in which the hair is growing to. And then another thing is before shaving, it's advisable to exfoliate the skin, wash the skin, make sure that area is clean, and then use something like lubricant. It could be a shaving cream. It can even be your normal soap that is there, or an oil, anything at all that will just make the surface better. So basically, it's not an infection. The action is from the sharp blade causing, let me just use the word trauma to the skin repeatedly, and then the skin just reacts. So there's nothing wrong. It's not an infection. The problem is just with the technique. So there are better methods, better ways to do it to avoid the bumps.
Okay.
So with emphasis to the hygiene, don't repeat plates, right? Don't repeat plates. So especially those ones that I know there are these old fashioned plates where you move the old plate,
Yeah,
put a
put
new
a
one, and
new
then
one.
yeah, you need to kind of wash it well. Wash the main appliance before you do not the blades, so you can't repeat the blades, but as you're putting the blade, you need to wash that one. Keep it. I think hygiene has a lot of role to play
Okay.
even in normal shaving and cutting your hair, if it is not sterilized,
Yeah.
kind of affects, gives you bump. Just
Okay.
on a normal basic technique people are using. Someone does it in a more hygienic way than this other person, and then you notice that, oh, I'm having bumps here and I'm not having bumps here. Yeah, so I think hygiene has a very
So
good.
there is something we see in recent times, waxing. How good is this? Because you can even prepare it in your personal space. So how good is waxing?
Well, I think waxing is the
Okay.
go-to method of shaving now because you could just buy a cream and then it helps you with the hair. But then
Okay.
people have even advanced beyond that, right?
Yeah.
They currently now there are procedures you can go to, and then they'll use UV rays. You hair won't grow again in that particular area. For real.
Yeah, actually.
Yeah.
Oh, we need the hairs.
What do you need the hairs for?
I don't know.
They're protective actually.
Yeah.
I heard it's
Some of them are.
protective. The hairs, they can protect you from an infection or something, especially for the ladies.
They are protective actually in a way.
Mm.
But then it doesn't mean that anybody should allow it to grow. Allow it to grow long time.
Okay. So this is probably a 24 years old guy. Can tight boxers reduce sperm count? Because I wear them a lot. And he doesn't want anything to happen to his sperm, actually. Is there anything like sperm count?
Of course,
Okay.
there's something like skin count.
Okay.
And then tight fitting boxers. That's
Boxers.
like one of the you know risk factors for
Okay.
infertility. It is.
Oh,
It is.
okay. So it
It
can.
can.
Okay.
Okay. Let me just explain in a way what really happens. It's so if you notice the male and the female, you notice that the female reproductive organ, that's the ovary, which is for the females, which is how will I put it now, is synonymous for the testicles in the male. It's inside the female's body, but that of the guy is outside. Reason being that in order for sperm production to occur, the testicles should be kept around a certain temperature that is only possible outside the body. So by the time he's always putting on tight boxers, it makes that area become heated, thereby altering the temperature that is supposed to be going on there. And then that's when sperm production will be altered. So it's not like okay, restricting blood flow to that area too.
Okay.
So that's what the tight boxers do. That is an issue. It's not like there's an issue with the boxer itself or with the company that's produced. But the
Okay.
fact that it is now altering the temperature and blood supply that is supposed to allow sperm production in the testicles. So,
Okay.
yes, that's what. So
So
free boxers are better than
than the
tight
tight
ones.
ones. All right. So what about the ladies? Tight pants, free pants?
They are
There's
fine.
nothing
It's
like
inside.
that.
Nothing is going on. I think
Okay.
the ladies is more of cotton underwear and
Okay.
the other types of underwears that is the issue,
Alright.
and that's just for the skin area and infection. I don't know. It doesn't
Okay.
affect fertility. In any way.
Okay. So this is from a 27 years old guy. He said he and his woman, oh, oppression, they are getting married soon. It's getting big.
Congratulations.
Congratulations. So, and they plan to enjoy the first year of their marriage, staying without a child. So, what are the natural family planning methods they can use?
Okay. Usually, family planning method is dependent on the lady, what
Okay.
she's comfortable with, what she expects or what she desires during the method she's using, and then the duration also, because there are some that people put in and they can last up to like 5 years, 3 years, and the rest. So for them that are looking at a long time, which is 1 year, they are you just is going to the hospital actually, and then
Okay.
discussing with whoever you meet there, talk
Like a
about
family
the-
doctor.
Yes, not necessarily family doctors. I think in a hospital there in Aristut, there's a nurse that is in charge of it, and
Okay.
she can actually put you through. She tell you about the different methods, the prices, and then you go ahead and choose which one will be suitable for you. Reason why I'm talking about suitable is that there are certain side effects with some of them, and some of them that alter a woman's period. So there are certain ladies that once their periods are altered, they are not comfortable, they are not okay. They feel like something is wrong. So if you're avoiding that, you don't want to use a family planning method that will make you very uncomfortable. There are also natural methods also like the withdrawal method, which is not very efficient because you can't always bank on the man to withdraw. And then there's if a lady understands her cycle properly, she knows when she's expected to ovulate. She keeps a calendar or uses that flow app that ladies use. So those are natural methods of preventing pregnancies. There are actually other methods too. There's this old thing where you can even tell from the girl's temperature at the time if she's ovulating or not. So yes, it's an old method.
Okay.
So that's for natural methods. Then the other methods are the ones that you actually have to go to the hospital to get in.
Okay. What about you?
Yeah, I'm concerned if he knows what natural methods are and why is he opting for natural methods. He should opt for efficient methods to prevent pregnancy for that 1 year period. So
Okay.
the methods that should be emphasized on shouldn't just be natural. It
Okay.
should be what can work for us for this 1 year. And that's what he should focus on when he goes to the hospital.
Okay. All right. So this is from a 25 years old. I had sex with a girl during her period. That's crazy. Do you think it's harmful to me or her?
You had sex with her without protection
Yes, during her
during her
period.
period. Well, number one, too much blood. Too
Okay.
much blood there, and then the contact with him, it has more chances. If they don't know her status, he doesn't know his status, and then they're having intercourse at that particular time, they have a higher chance of contracting infections
Okay.
than when she is not.
Okay.
And reason being that it's the blood. The blood is the medium for a lot of things, right?
Okay.
And the hygiene at that time, at the period time, is not so good. So has another high chance of contracting an infection.
Okay.
Other than that, other than infection, is there anything that's going to happen to them? No, I don't think
Okay.
there's anything that's going to happen.
All right.
Okay, so I won't be saying anything new either. Usually there are like it is as advantages and disadvantages of things because you actually hear some people see that sex during their period makes them feel better, it reduces the pain. I've heard something like that actually.
Yes.
And then there are times when the disadvantages are actually more, and so you actually have to avoid such things. So for a girl, while she's seeing her period, the cervix, which is the entrance to the womb, is actually open during that period, and so it can allow free passages of things, bacteria and other organisms. And so, like he said, it's just infection. There's actually nothing else. Both for the guy and both for the girl. So is it harmful to the both of them? Yes. What's the harm? It's just
So
infection.
they should check themselves.
Yes, they should check themselves, and even if they are free, they should still avoid having sex during period.
Be
Plus,
protected. Be protected.
just
Okay.
protected.
Yes, because now there's no treatment for HIV and AIDS actually. All right. So this is from a 24 years old guy. How do I know when I have erectile dysfunction?
How do you know when you have erectile dysfunction?
The symptoms.
Well, no, erectile dysfunction is not being able to achieve full erection or not being able to have penetrative sex, right? And how do you know? How do you know? It has to do with your past history.
Okay.
Have you had, have you attained better erection before this time? And then you're checking yourself, you know that, okay, my erection is not as strong as what it used to be. So it has to do with your history. You examine yourself, you find out what it is, and then you know that, okay, I'm tilting towards having weaker erections. But then it has to do with a period of time. So it's not something that just happens. But then when you're unable to attain erection when needed, spontaneous erection when needed, then you know, okay, I need to check myself. I'm tilting towards erectile dysfunction.
Okay.
Okay, just like I said already, I was trying to get the exact definition. I think it has something to do with being able to achieve and then maintain.
Okay.
Yes, in order to have easy satisfactory sexual intercourse, something like that. That's the definition. So, like he said, if before you know that you were able to attain erection and sustain it for a particular amount of time, and then you begin to see that there is a change, and like he said, the period of time, if your course was just once and twice, of course you're not bothered if you're going back to normal. But then if you're noticing it over a long period of time, then you're becoming concerned. So an inability to achieve, even if like I think there are some persons that even complain that they're actually attracted to this person, but then they cannot get an erection. So if you're unable to achieve, or even if you achieve, you're not able to maintain in order to have that sexual intercourse for the amount of
Okay.
time that you probably used to have, that's when you start being concerned that there's an issue.
All right. So the next one is from a 29 years old guy. This is heavy. This one is heavy. What are the natural ways to increase the size of my penis? His penis, sorry. His own.
Well. I have to talk from theories now.
Yes.
And one of the theories is that one of the theories is that masturbation actually helps
Okay.
increase size, penile size, especially if you're masturbating and um, you're not achieving orgasm.
Okay.
So it's a theory, so to speak, and it's not something would give out there.
Okay.
You say, okay, this is a tested and proven way to
Increase.
increase your size. No,
Mm.
I don't think so. Well, there are pumps. There are pumps out there that people buy and then they use.
Okay.
And then they do surgeries too.
They're heavy.
But then they do surgeries to increase
That's the
penile.
surgery.
That's
Okay.
the surgeries to increase penile length. Other than that, you have to be thankful to what God has given you.
What do you think?
Well, I've actually not heard of any natural method that there is in increasing penile size. Actually, I've not heard of any. In my theories, I don't have any. The only one that I've probably heard of are probably all these plastic reconstruction surgeries and the
Okay.
rest. But if it comes to natural methods, no, I've not heard of any actually. And I know that there are actually things out there, but the problem is when you do these things, what are the consequences? What are the downside? What
Okay.
happens in the next 10 years after you've taken this choice? So that's what you should consider. If possible, seek professional help if there is a way. But for natural stay-at-home methods, no, I've not heard of
And
any
then I
actually.
think I would like to debunk when you hear people sell drugs to
Yeah.
increase.
Crazy.
There's no tested and it is not scientific. It
Okay.
hasn't been proven that if I take this drug I'll increase, especially for ladies and men too. They sell some drugs that it will help you increase
Yes.
your hip size and
Yeah.
no, they are not tested and proven.
So it's healthy to thank God for what you have.
Be grateful.
All right. So the last one here is from a 22 years old girl. I feel sexually active always ever since I was molested as a child. What can I do medically to reduce the sexual urge or stop it totally? It's ruining me.
Okay. She feels sexually active
Yes,
ever since she was
was
molested
molested.
as a child. Okay, so basically there's a history here.
Yeah.
So whatever is happening, it's coming from what has happened previously. Well, that means that it's where her mind. I don't know. I don't. There's a lot to say. First of all, what has happened to her is a traumatic event. It's not something that should happen to anyone. So one thing that should be involved in this is seeking professional help.
Okay.
That's number one, to get past what has happened before. Then there was something he was seriously emphasizing on when he talked about masturbation. Triggers. There are things
Okay.
they call triggers, yes. So I don't think if if you're in a tight situation where you're very busy working or very busy doing something, your mind will actually be drifting towards, sexual intercourse or sexual pleasures or things like that. So it's about triggers. If you know that there are certain things that you see, certain things that remind you or that stir up the urge, it's best to stay away from them. And this, so most times, it's very difficult to overcome addictions on a person's own as per se. So you actually need somebody to help see you through. It must not necessarily be a professional.
Okay.
Or like you said, an accountability partner in this will also work out.
Okay.
For this issue, I don't know, it's a very dire issue actually. I don't know how to put it, it's a very delicate matter.
Yeah.
It's not something that you just sit and then one day it ends. I don't think it's like that. It's actually going to take a lot of conscious effort, a lot of avoiding a lot of things, a lot of abstaining from a lot of things, a lot of giving up a lot of things actually. So first of all, she should seek professional help. I don't think it's something she can do on her own in
Okay.
any way, and then she should be really to push through to the end. Consistency, she really does want to stop.
Okay.
I've seen my heart goes out to her and sorry for such an event and in trying to combat this, she shouldn't have the mindset that she wants to stop the urge completely. Because I heard it in the question, right? The urge is a normal thing. What is abnormal is the excess
Yes.
in it. So her personal efforts and the effort of a professional is trying to modify the excesses and normalize it. So if she knows of things that she can do to normalize it, she start doing them, and she's also starting to seek professional help.
Okay.
But she shouldn't think of eliminating it, because
Alright.
she'll not start looking for professional help to get it back.
Okay. So you guys have taught me a lot actually. From these questions, I've learned personally from you. So we won't leave this studio without you both giving us your final advice to the audience. I'll start from you.
Well, I'll say be active, be conscious about your health, take
Okay.
conscious decisions daily in your thoughts, think healthy, in your words, speak healthy words to people, to yourself. It helps you to be healthy. And then do healthy things, diet, exercise, visit the doctor, be active, be
Okay.
conscious of trying to be healthy.
All right.
Okay, what I would like to talk about is how do I put this? Is there's an extreme to both ends. I want to talk about seeking professional help, the importance of it, and then at the same time, the things that you can do on your own. What I mean is this: there are certain questions, most of these questions, and certain things that you can actually go online. Like we have the internet there, and for this age, it's actually a very beautiful thing, even though it has its downside. So there's a lot of information that you can gather from the internet. So go ahead and use what you have. Use your phones when you have questions. Do research. Ask AIs. Ask. You can also, you must not only bank on AIs. You can also look for how will I put this now? Research works, things that are actually scientifically proven that this works out, and then you apply them. Also, while you're doing this, Google Doctor is not always the best.
Yeah.
At the same time, there are certain things like we mentioned here that you do not sit at home and
To
sort
do.
out. So when you've seen that it is necessary, it is vital, even when you go online and search about a health issue, you always see where they will tell you when to seek help from your doctor. There's
Yes.
always that tab there.
provision.
So when you know
Seek
that,
help.
yes. So when you know that it has gotten to that level, it is very important that you actually go to the hospital. I don't know, there's this thing that we have in our country that we are seriously trying to eliminate. We have where people only come to the hospital when the condition has become very bad.
Yes.
It's now extreme, and there's even nothing much that they can do to help you. Meanwhile, if you had come in earlier when it was better, it would have been way easier to have made the issue, like combated the issue easily. So while you are getting information from the internet, which is actually very nice, which saves you a lot and actually gives you valuable knowledge, you should also know when you are getting to a place where you actually need to go to the hospital. And please do seek help on time. That's what I have to say to the audience.
All
Thank you very
right.
much.
Wow. All I can say is wow. I feel blessed to have you guys today. All right. For my audience, I personally have learned a lot. I hope you've gotten answers to your questions. Over to the most interesting and exciting parts of the Bliss Hour. It's game times. Yes, game times. This is where we'll watch our guests play games. I know you don't want to miss this part. We'll go on a short break and we'll be right back. Welcome back from that short break, guys. Like I said, it's the game time with the Bliss Hour. Hope you're happy.
I am.
All right. So the rule of this game is that in 60 seconds, you're going to answer my question. Once your time is up, if you don't answer the question, you lose. If you answer the question, you win.
Okay, I hope
Yes, let's win the guy. Hopefully. All right. Our time starts now, right? So our time starts now.
Okay.
One food you eat forever.
Fried plantains.
Favorite childhood cartoon.
Lion King.
Last song you listen to.
Shoemaker by
Morning
Once
person
Mansella.
or a night owl. Morning person.
Night person. Night owl.
One word that describes you.
Loving.
One celebrity you would love to meet.
Andrea Bocelli.
Last thing on your Google search history.
I can't remember.
One item you always carry around.
My phone.
One weird talent you have.
Weird talent. I can't think of any.
Would you sing everything you just said now in song from the beginning? Sing it like a song or maybe a rhyme.
I can't remember everything. So I think I started from fried plantains, shoemaker, night owl. I can't remember the rest.
All right. So time is up.
Okay.
So you know the rule of the game. In 60 seconds, you answer your question.
All right.
Are we good?
Yeah,
Are you
I'm
happy?
good. I am
Just smile for us.
happy.
Okay. One weird talent you have.
Singing.
One item you always carry around.
Power bank.
Last thing on your Google search history.
I can't remember.
One celebrity you love to meet.
Big Sean.
One word that describes you.
Weird.
Morning person or night owl.
Night.
Last song you listen to.
Boundaries. Big Sean.
Favorite childhood cartoon.
Tarzan.
One food you will eat forever.
Garian soup.
Now sing it as a song.
Big Sean is a nice person who loves Garian soup. He watches Tarzan.
Okay.
And I can't remember something.
All right. It's up. Finally, we've come to the end of this episode with the Bliss Hour. I hope you enjoyed this episode because I did. Do not forget to subscribe to our YouTube channel. Follow us on all social media platforms at the Bliss Hour. Until next time, I remain your beautiful host, Bliss. Bye.